ED though?
It's usually because our doc wanted it actually, as opposed to the radiologist.
That's probably what it is. Yeah. For some
Got it?
reason, that looks not straight.
And now it's just 7 by 17.
It's not straight.
You'd open up the column.
Does it need to be straight? I don't know. Does this need to be done that?
Big and wide, as wide as it'll go. There you go, like a chest
This
X-ray.
is the L spine, right?
We're gonna be between the
Fine.
sternal notch and the xiphoid process. They come together, that's called T7.
That's what we're centering it on?
Yeah.
That's your centering point.
Sternal notch
Yeah,
and xiphoid.
it's where we actually,
So you gotta. Oh, we cannot feel each
How
other.
do we do it on women?
who can't feel each other?
Like right there, we can't do all that.
Sure, you just can wait, you don't have to not palpate breast tissue to fucking doing imaging. What is this talking about?
Okay.
I don't know what we're talking about. It's like, where are you working that people aren't actually palpating?
No, they're not. They're not doing all
No, that
that.
doesn't
They
work.
do X-ray.
That's how
eyes.
you repeat images, actually.
And Miss
Yeah, I don't
Fong
text
was
me.
like,
That's what they
absolutely
do, right?
not. Like, no
Xiphoid?
synthesis, none of that.
Right there,
Oh, see how he
T7.
did that?
Oh,
Oh, wait, okay, wait.
So
Try,
we-
It's like a chest X-ray, by the way. It's
So
just
we
a
come
collimated
together.
collimation. Pardon me?
can you try that again?
Well,
Literally a chest.
so I want to make it as easy as possible. And this is really a chest X-ray collimated to 7 inches,
Yeah.
first of all, okay?
Okay.
But since the book wants you to know that this is a T7, I palpate for the xiphoid process. Sternal notch. I bring my fingers together. That's called T7.
So that's where.
Okay.
Central A is
okay,
a
so the notch to
T7.
notch and then.
Yeah, notch to
Okay.
notch. Xiphoid to notch.
7 by 7.
The other way to do it is some people, if you're small enough, she's actually talking about not touching breast tissue. I don't know what she's working on, right? But you can actually do the chicken wing, figure out where the inferior border of the scapula is, because that is T7 also.
Oh, okay.
Chicken wing.
Very good. The breathing is just suspension and expiration. I'm not sure I'm gonna make it through the day. Cool.
Me either.
All right. Anybody have any questions on that? I think you're the last group who cares anything about this. No? That seems obvious, right?
Yes.
Good. A lateral. He's gonna roll to his left side. All the way to his left side.
Wow, okay.
Keep rotating. He's gonna pray, so he's gonna bring his knees up to his chest slightly, arms out in front of him so the humeral heads are out of the vertebral bodies. Rotating forward. We're gonna move his right or left shoulder so he's truly lateral. If he's not, he's kind of oblique. No, keep that hand in front of you, sir. We're gonna do this to him. Drag him. I'm sorry, drag him. Beat up the shit out of my patient. There. Now he's lateral, right? I've actually dragged his shoulder up. But I didn't kill him. Come on. Now we know where the T7 is because we can feel for the inferior border of the scapula. We're going to take the lead shield. I'm glad everybody's enjoying this. We're going to place that there because what we want to make sure is that the exposure doesn't terminate too soon. And we actually use a photo timer on it more often than not. For this exposure, we make a longer exposure to blur out the lung markings and the ribs.
It's about 2043.
We tell the
That
patient,
should be further back.
pant like a dog for me.
So it's,
No?
what hand trick do you do for this one?
Well,
To figure out
Yeah,
where,
yeah,
Just feel those.
chicken wing.
like,
Put your arm up and down for me. At the inferior border of his scapula, which is there.
mm-hmm,
Put your hand on him.
right here, mm-hmm, but it's right up here.
Yep, he's gonna step on it.
Okay.
That's it. The way we know that this is gonna work is like, he's broad. As you can imagine, chest can get broader and broader. Because of the inverse square law, this gets smaller and smaller the further away from the image receptor.
Mm-hmm.
If I drag the image receptor out, even though I'm like, I don't know if it's right, I can see that I'm gonna capture him from him to here. I know I'm gonna get him. Good? Go
So
around there and tell him to breathe like a chicken.
does it just go,
It's been a long day.
How does chicken breathe?
Hand like a dog.
And like a dog.
so how do you know it's in the right spot? It's just, because you know how like you would put your hand. And
Right,
then you
I've
make sure it's
actually,
not on
would
the
you put
spot.
your arm down again for me? I'm actually, what you did is you felt for the inferior border of the scapula. That tells me that that's T7 on a patient.
Yeah, but I'm talking like the you
Oh,
know
mid-coronally.
okay. Okay.
It was like
Okay.
Good job.
1 divided by 1 mega gigahertz.
Now, the swimmers is that left hand goes up on his head, right arm goes down towards his foot. We're gonna collimate down, and we're gonna feel for the vertebral prominence,
And
place the
they're
central ray there.
lateral like this.
Correct.
Yeah.
It's as if he's standing, but now we have him tabletop.
Okay.
We're gonna collimate down really tightly on it.
At C7.
C7. Now David's gonna follow the curve of the spine, so he's slightly angling the tube, he's changing it from the axis, which you can do.
Okay.
Should it be
18 by
open
30.
more or no?
Hmm?
Should it be open more or no?
A reciprocating bucky will do that. What's that?
Oh, the collimation should be open wise.
No, it can be that small.
Oh,
Most sites actually use a 2-inch collimation,
So he
just on the
needs
joint
to
space.
change the tube angle.
The tube
Is that what you were
angle.
to
saying?
match it?
No.
No,
You don't have
David's trying to show you something fancy. We know that the spine actually
Oh, okay, okay.
has lordotic and concave curves to it. So
Mhm.
he's just noticing that the spine does that, so he thought maybe he would change that
To make it match.
such a ray so it mimicked the anatomy of it, which is
Oh,
fine.
18 by
Okay.
24.
You'll see technologies do that. Same thing you see when you see people do frog legs. Sometimes they'll angle the tube.
Yeah.
Same,
Okay.
he's just doing the same thing.
Okay.
Well, we gotta put it in centimeters.
It doesn't change the reciprocating bucky's ability to clean up the image.
Okay.
When you elongate it one way or the other, or sideways this way, the tube itself, then you have to actually compensate for where the central ray meets it.
So 5 by 5.
That won't
Okay.
do anything to it. Are you okay with me telling you this?
5 by 5.
Yeah.
I know you've had a long day.
Yeah. Yeah.
What he's doing is fine, is really what I want to know.
Okay.
Cool? Good job. Now we'll
Okay.
move on to the lumbar.